Psychology experiments have helped unravel the mysteries of human behavior, but sometimes, in the quest for knowledge, ethical lines have been crossed. Today, these studies may have expanded our understanding of the mind, but they also inflicted emotional, physical, or psychological harm on their subjects. Buckle up, because these stories are as disturbing as they are fascinating. 10. The Milgram Experiment, 1961. In 1961, psychologist Stanley Milgram sought to understand obedience to authority following the Holocaust. Would ordinary people commit harmful acts simply because an authority figure told them to? Participants were assigned the role of teacher, while the learner was a Confederate, an actor in on the experiment. The teacher and learner were placed in separate rooms. The teacher was instructed to administer increasingly powerful electric shocks to the learner each time they answered a question incorrectly. Unbeknownst to the teacher, no real shocks were delivered. However, the learner acted as though they were in excruciating pain, screaming and begging for the experiment to stop. Despite this, many participants continued to administer shocks when prompted by the experimenter, who insisted they must proceed. Findings and fallout. The results were shocking. 65% of participants delivered what they believed to be lethal shocks. The study revealed the power of authority, but was heavily criticized for the emotional trauma it inflicted on participants. 9. The Little Albert Experiment, 1920. In 1920, behaviorist John B. Watson wanted to prove that fear could be conditioned into humans. His subject? An unsuspecting 8-month-old baby named Albert. Albert was introduced to various objects, including a white rat, a rabbit, and a dog. Initially, he showed no fear. Then, every time Albert reached for the white rat, Watson created a loud noise by striking a metal bar behind the child's head. The noise terrified Albert. Eventually, Albert began to associate the rat with the noise. He not only feared the rat, but also other furry objects, like rabbits and even Santa Claus's beard. While Watson proved his theory, the experiment likely traumatized Albert. Worse still, no follow-up was conducted to reverse the fear responses. 8. The Stanford Prison Experiment, 1971. Psychologist Philip Zimbardo conducted this infamous study to explore the psychological effects of perceived power dynamics between prisoners and guards. Zimbardo recruited 24 college students and randomly assigned them roles as either guards or prisoners in a mock prison set up in Stanford University's psychology department. Guards were given uniforms, sunglasses, and batons, while prisoners were issued smocks and assigned identification numbers. Over just 6 days, the guards began displaying abusive and sadistic behavior. They forced prisoners to perform humiliating acts, deprived them of basic needs, and locked them in small, dark closets. Zimbardo himself, acting as the prison superintendent, became so immersed in the role that he failed to recognize the severity of the abuse. The experiment, intended to last 2 weeks, was cut short due to psychological breakdowns among the participants. It highlighted the dangers of unchecked power, but was widely condemned for its lack of oversight and ethical consideration. 7. The Monkey Drug Trials, 1969. In 1969, researchers at the University of Michigan conducted a chilling study to explore drug addiction. Instead of human subjects, they used monkeys. Monkeys were trained to self-administer drugs, including cocaine, morphine, LSD, and amphetamines. Once hooked, the animals were left to their own devices. Many of the monkeys began displaying erratic behavior, tearing out their fur, breaking their limbs, and even starving themselves in favor of drug consumption. While the study revealed how addictive substances can override basic survival instincts, it was widely condemned for its extreme cruelty. The findings were also criticized for their limited applicability to humans. 6. The Bobo Doll Experiment, 1961-1963. Albert Bandura wanted to prove that aggression could be learned through observation. He conducted a series of studies using children and an inflatable clown doll known as Bobo. Bandura showed groups of children different scenarios. One group watched an adult physically and verbally abuse the Bobo doll, while another group watched the adult play peacefully. When left alone with the doll, children who observed aggression imitated it, punching and kicking the doll with alarming ferocity. Bandura demonstrated the power of observational learning, but critics argued that exposing children to violent behavior, even in a controlled setting, could have long-term consequences on their development. 5. Homosexual aversion therapy, 1967. This controversial method was used to cure homosexuality, reflecting the prejudice of the time. In the UK, researchers at Crumpsall Hospital subjected gay men to electric shocks while showing them images of men. The participants were told to keep looking at the images, but after 8 seconds, they were shocked. Images of women were shown as reward stimuli with no punishment. While some participants claimed to experience changes, the American Psychological Association later declared such therapies ineffective and harmful. The method left many subjects emotionally scarred. 4. The Third Wave, 1967. High school teacher Ron Jones devised this social experiment to demonstrate how fascism could take hold. Jones implemented strict rules in his classroom, emphasizing discipline, unity, and conformity. Over 5 days, the students adopted authoritarian behaviors, created a logo, and enforced obedience. By the third day, the movement had spread beyond the classroom. Students came up with their own insignia and adopted a Nazi-like salute. They were taught to firmly obey Jones's commands and become anti-democratic to the core, even informing on one another. Jones's new ideology was dubbed the Third Wave and spread like wildfire. By the 4th day, the teacher was concerned that the movement he had unleashed was getting out of hand. He brought the experiment to a halt. On the 5th day, he told the students that they had invoked a similar feeling of supremacy to that of the German people under the Nazi regime. Thankfully, there were no repercussions. Fearing he had gone too far, Jones ended the experiment by showing the students how easily they had succumbed to authoritarian control, drawing parallels to Nazi Germany. 3. UCLA Schizophrenia Medication Experiment, 1983-1994. This long-term study investigated the relapse patterns of schizophrenia by discontinuing patients' medications. To achieve this, they had schizophrenics, from a group of hundreds involved in the program, taken off their medication. Such medication is not without its nasty side effect. The research may hold important findings about the condition. Nevertheless, the experiment has been criticized for not sufficiently protecting the patients in the event of schizophrenic symptoms returning, nor did it clearly determine the point at which the patients should be treated again. What is more, this had tragic consequences in 1991 when former program participant Antonio Lamadrid ended his time on Earth by jumping from 9 floors up, despite having been open about his state of mind and supposedly under the study's watch. Ethical concerns. Critics argued that the researchers prioritized data over patient well-being, failing to intervene when symptoms worsened. 2. The Monster Study, 1939. Dr. Wendell Johnson tested the impact of positive and negative reinforcement on children's speech development. 22 orphaned children, 10 of whom had issues with stuttering, were put into 2 groups, each containing a mix of those with and without speech disorders. One of the 2 groups was given positive, encouraging feedback about their verbal communication, while the other was utterly disparaged for their, sometimes non-existent, speech problems. The findings were recorded. This 6-month study had a major impact on the human subjects. It even had impact on those who had no prior talking difficulties, making some insecure and withdrawn. In 2007, half a dozen of the former subjects were given a large payout by the state of Iowa for what they had endured, with the claimants reporting lifelong psychological and emotional scars. Results: the negatively reinforced group developed speech issues and low self-esteem, with effects lasting well into adulthood. 1. The David Reimer case, 1967-1977. After a botched circumcision procedure left Reimer with disfiguring genital damage at 6 months old, his parents took him to be seen by John Money. Money was a professor of medical psychology and pediatrics who advocated the theory of gender neutrality. He argued that gender identity is first and foremost learned socially from a young age. Money suggested that although Reiner's penis could not be repaired, he could and should undergo sex reassignment surgery and be raised as a female. In 1967, Reimer began the treatment that would turn him into Brenda. However, despite further visits to Money over the next 10 years, Reimer was never really able to identify himself as female and lived as a male from the age of 14. He would go on to have treatment to undo the sex reassignment, but the ongoing experiment had prompted extreme depression in him, an underlying factor that contributed to him ending his time on Earth in 2004. John Money, meanwhile, was mired in controversy. These experiments highlight the dark side of psychological research. While they provided groundbreaking insights, they also serve as cautionary tales about the importance of ethics in science. Let us learn from these mistakes and ensure that no pursuit of knowledge ever comes at the expense of human dignity again. Thank you so much for watching. If you are interested in all things that are strange, mysterious, or creepy, then please subscribe to my channel for more content like this and more. Until next time, please stay safe out there, and as always, stay curious.